Now, on this call, I signed up for burnout, and this is something that but I'm gonna over exaggerate it a little bit on the call. Um, I'm a secret shopper. I'm kind of curious to see um, how easy it is to get meds. This is with a psychiatrist. I'm also curious too because this is something I struggle with. I tend to think, like constantly be thinking. It's one of the things that's been, one of my Achilles heels. So, um, yeah, I'm just gonna click the link and get started. I'm gonna have to join it. So I'm actually gonna switch to audio recording. I'm gonna put it on my phone. Um, okay, so yeah, all right. I'm just gonna do this on my phone. Then I'm gonna have to leave this meeting.
Hey, hey, how's it going? Let me turn it on real quick. Oh, there we go. Hey, how's it going? I'm in Pacifica right now, California, and date of birth December 27th, 1990. I'm not entirely sure. Like, I mean, maybe, but so I'd say like right now, um, I know I smoke weed, right? So I'm already on a medication, right? Even though it's not prescribed or anything. I probably smoke too much weed. And I've worked with this for a while. It's actually not really interfering with my life in any way. I mean, it's probably hindering my potential and all that, but I don't know. It doesn't. It's very little negative consequences. And anyways, I know it's because I know it's in part related because like basically like just working too much can't like the mind constantly thinking uh yeah, like kind of basically it shuts down my mind a little bit. Probably slows me down too because I tend to just keep working. Um, anyways, so I'm reaching out to Brightside. I know I don't know. I'm just impressed with the Brightside platform, and so yeah, I figured I'd give this a shot and see what your thoughts were. Um, I don't know. I'm not really looking for a prescription, but like maybe, but like, eh. I mean, yeah, just figured I'd give this a shot. So pretty low expectations, or just I'm pretty open minded right now. Just curious on your thoughts. Yeah. Yeah, yeah, yeah. So that might just be that easy. Like I was thinking more like thinking or anxiety or something, but I don't know. I mean, but it's totally fine too. Like what's up?
I think you have marked down, it doesn't really put you to the criteria for us to diagnose you with depression. But that the numbers aren't everything. I just really want to know how you are feeling. I'm just kind of going through because I can see something objective, so I just wanted to translate it into, into the words so we understand where we're at. But generally, uh, according to this, you're not depressed. Okay,
Yeah,
you seem like you're generally doing okay.
yeah,
Anxiety wise, you mark down some things that you're worried, you're anxious, sometimes difficulty relaxing. That puts you into the mild category of being
yeah.
clinically, let's just say, depressed. Okay. And let's see what other stuff that is really going on. I mean, I know you mentioned something about the burnout. I mean, is this are you working too much, then you feel like you're just burning out? What's happening with that?
Kinda, yeah. Like yeah. It's not like depression or anything where you stay in bed. It's sort of more like keep going. It's interesting with anxiety. I think like it's hard for me to feel my anxiety. That's kind of like one thing. Maybe that's why I'm drawn to weed. But I know it tends to be like a mental anxiety rather than like a physical one. So you're asking like how I felt. Maybe it's like dimly there, sort of in the body, like tensing up and stuff. butterflies or whatnot, but it definitely is more like mentally thinking. Um, so burnout. Yeah, it seems like not too bad. This is mild. This is mild. It's not the worst, but
Do you do
yeah.
therapy, Jared?
Yeah, a little bit here and
Yeah?
there. Yeah, yeah. It's
Here and
it's
there. So
helped
like
before. It's
you
helped
have a
before.
therapist, you're doing it off and on?
Yeah, off and on. I do have one, but I should get in contact with them, I guess. But also I kind of am like, what else is out there too? Like, I mean, signed up for the therapy at Brightside too. Like, I mean, um, so I'm interested in that as
Okay.
well. Yeah.
Okay, very
Um,
good. Now, what kind of work do you do?
I am a counselor.
For what do you do? Like for what area? There's so many counselors.
Yeah, yeah. There's
Like school counselor or whatever.
it's working with eating disorders, so I'm kind of on the floor. It's also like helping with the house. It's a residential one. And then like food prep, make like being there with the clients, and then and then working with the clients too. That's like a big part of the job. Calming, comforting, panic attacks,
So you're
dissociations,
in a
food
residential
rules.
program working with patients who have eating disorders.
Yeah, yeah,
I
yeah,
see. Okay.
yeah.
Now, is your job stressful?
It can be. For sure. Like some days it's really chill, other days it's just stressful as shit. Like, yeah, yeah. If someone runs away, you gotta like get the cops involved, and no fun, no fun, panic attacks and all that stuff. It can be some days can be tough for sure.
Okay, fair enough.
But yeah,
Then
like
you had a city for how?
I don't overthink like that. Like, sure. I mean, it's definitely like my I think too much. I think too much. I got an active thinking part. Um, nah, it's not the worst thing in the world. I think well adjusted, but yeah, I mean, I think much.
Okay, so you think much. Now, will that you have ever been diagnosed with or taking medication for your anxiety?
No, never diagnosed with anything. That's where I'm at
How
with
many
it.
years? How many years?
Mm, uh, probably like 3 4 years. But it's started smoking in high school, and then maybe in college started smoking more, and then I don't know, shit, like just uh just I don't know, kept becoming slowly more a part of my life, kind of like a weed. Like a but also I don't know, I don't feel any guilt or shame around it. Like I really have. I mean, I guess I do to some degree. Um, I have some internal conflict around it, but I don't know. I'm also like, here I am talking about it and not feeling that bad
Mm-hmm.
about it. Like, I mean, it doesn't really hurt me. It doesn't. Yeah, it doesn't like slow me down. I can work. It doesn't stop me from working, right? It doesn't stop
Yeah.
me from connecting to people or like I don't know, things like this.
Okay. So
Yeah,
you've been doing weed at least a good
yeah,
4 years. I mean,
yeah.
no, why? You started in high school, so that's way more than that.
I mean, like, yeah. Why? I think it's I don't know. So this is like, yeah. I think my parents are very good at not feeling their emotions. Like, I feel like this is my way of not feeling.
Yeah, because
Sort
you're
of
taking
like,
the weed, it's
yeah,
calming you down. You're not
yeah,
really
yeah,
thinking about so many things, so it relaxes you. So
yeah.
here we are. So
Pretty much,
okay,
pretty much.
so
Yeah.
have you ever been hospitalized for any mental health issues?
No, no, no,
Okay, any self-harm or history of abuse?
no.
Okay, appetite okay?
Yeah, yeah,
Okay, sleep is okay?
yeah. It's all right, I guess.
Okay.
You get more, but yeah.
And then any smoking, nicotine, or anything else?
No, no cigarettes.
No
Yeah,
cigarettes. And then
no vapes.
parents have any mental health issues or siblings? Anyone you know?
Not diagnosed, I guess. Yeah, yeah.
Okay.
I
So
think my
tell
uncle.
me,
Yeah.
what can I do to help you? Like, you obviously had anxiety for most of your life. You self-medicated yourself with the weed. So what is it that's bothering you right now that you felt like you really needed to see someone? What are
Um.
your goals for this
It was,
treatment?
yeah, like with try something new. I do think therapy's good. Um, I guess I've been seeing one therapist for like kind of attachment stuff, but in my opinion, it's kind of like vague. I don't know. Um, yeah, so like kind of like the science, science of CBT and whatever, like kind of like that. Like I'm like, okay, like let's do something with like more evidence based, like let's try something like more that. So kind of trying it out. I don't know. Yeah, like I don't know. Yeah, I don't know how the prescription side can help necessarily. Like I'm not looking, like I said, I'm not really looking for anything particular. Just I was like, maybe like let's just see if it's not. Yeah, it sounds like uh yeah, like not recommending a prescription, which is cool. Like that's good with me. Like that's okay, cool. Like I can like get that off my to-do list. Like let's focus on the therapy more. So anyways,
Look,
I mean that's
what I would really tell you is, look, you don't have anxiety based on, I mean, depression based on the information you've provided, and you don't seem like a depressed person. You seem
yeah,
like
yeah.
you're
Yeah.
functioning, you're doing okay. I think you do have anxiety. You have had anxiety all of your life, and look, weed is not good.
Yeah, I
I will
know,
have
I
to
know,
tell
I
you,
know, I know.
it causes addiction,
Yeah,
it causes long-term anxiety, and it causes panic attacks.
yeah,
People get used to it, they do more and more.
yeah.
Yes, it does help you, it calms you down, it helps you with your sleep, it helps you with your anxiety, but you're not really addressing the problems.
I
Like,
know.
for example, what is it that makes you anxious, right? So, anxiety is something that you can be triggered by, or you're just normally an overthinker. Are you an anxious person? Some people are just like that. They'll just worry about everything,
Yeah,
okay?
yeah,
And some
yeah.
people, they get very anxious, that it's very situational. Some people are just too over planning for life, like, always worried. What about I have a job, what if I get laid off, what if this is going to happen? So all of those things gives people anxiety, right?
Mm.
So with you, it seems like you're a pretty functional guy, but sometimes weed can really slow people down
I
if
know.
you start smoking weed very early in life, because for men you go through a lot of neuron changes up to an age 29, for example, for boys, okay? Because your brain goes through this remodeling phase where you develop a lot more neurons, your brain is very fresh, the more, so the happier things, good things you feed to your brain, that's what's going to happen. Because, when your brain is going to this remodel, developmental phase, adding toxins to your brain, styles, significant alcohol, weed, and different types of drugs. I mean, in your case, it's just marijuana. It doesn't help you. What it does, it slows you down, makes you tired, makes you lazy, makes you very unmotivated. You're just blah, okay? So you just grow
Yeah.
up, you're just semi-functional. You're doing good, you feel good because you're still working, you're
I
still
know,
going
but
to
this
school,
is
you're
so
doing.
yeah, yeah, it's so interesting. Yeah, no, I mean, I hear you. It's like I hear you. Yeah, it's almost like I don't know. Yeah, no, yeah, these are all internal conversations I've definitely had. It's not like the motivation isn't there. I'm a top performer. Um, it's to take the edge off, It's like I don't know, but
But you can do
yeah,
other
I
things to
could do
take the
other
edge
things.
off.
It is like the
You can
reaching the potential. It's like yeah, it's something like that, but
healthier coping skills, therapy, exercise, meditation, listening to music. It doesn't have to be weed. There is so many different things we can do. And I'm not just saying this because, like, it's
I
not
know,
about
I
the
know.
prescription medication.
Yeah,
There's
yeah.
so many better coping
I just
skills
don't have a
that,
why right now. I don't have a why to stop. You know what I mean? Like, dude, I meditate. Like, I do my self care's on point. Like, I eat healthy and all this. Like,
right.
I know everything. Like, but I don't have a why. Like, why not smoke weed? I mean, it's I don't know. Like, my one regret from it is that I don't remember my dreams. Like, I want to get to know myself better. I think dreams are good. And that's like the one emotional thing that's like kind of like, like that. Damn, like that's the one thing like weed does that. Like, damn, like. But other than that, like I just don't have a strong enough reason not to. I mean, yeah, it's just not like I'm not lazy. I'm not like isolating. I'm not. Um, I don't know. And 2 grams a week, is it like, I don't know, a couple puffs a day? I don't know. Like my tolerance is pretty high. Like it doesn't impact me that much. See, so yeah, this is my internal conflict. I don't have a strong enough why. So I hear all the things. You're right on all of them. I just, yeah, I don't know. Yeah, that's kind of sort of where I'm at.
Well, most people would actually start with because they actually have anxiety. And
Yeah,
then
yeah,
for me,
yeah.
it's very important to really identify what our triggers are for anxiety. Why do we have
I
anxiety? It's
know.
like,
That's a tricky
it's
one.
like, when you have allergies, right? First, you have symptoms because you have runny nose, your eyes get watery, some people can't breathe well, whatever. Depending on allergies, can be so many
It's
different
like,
things,
I'd say it's a
right?
mixture of boredom. It can be a mixture of boredom and like wanting to slow down, and also sort of this like it can be an impulse too, like just a, I don't know,
It's
craving, or
habitual. You got
it's
used to
habitual.
it,
It's
and then
habitual. Yeah, it's habitual.
it's
Yeah, yeah,
probably more of a
yeah,
social thing right now. You kind of started with that and
yeah, yeah,
got
yeah,
into
yeah,
it. You're still functional. You don't feel like you need to stop because you're still carrying on with your life. You don't see it as a problem,
yeah,
okay? But
yeah, kind of.
obviously something isn't right.
I
Just because
know,
you are
right?
going to work and you are functioning, it doesn't mean your life is where you are completely happy. Obviously, if you were totally happy, we
Yeah,
wouldn't be having this conversation, you and I
right?
together.
Yeah,
Okay?
yeah,
What
yeah.
I
Hmm.
recommend you do
Hmm.
is I don't think you should really use prescription medication.
Oh, that's good. That's good. That's good to hear. Thank you. Yeah,
Okay?
yeah, yeah.
I'm not all about medications.
That's cool.
I think it's great for some people who truly need it.
Hmm.
But I would like for you to do therapy
Yeah.
because you will learn how to manage particular situations, how to organize your life, how to manage your life, find out what your triggers are. Why are
Yeah,
you doing
yeah.
these things? Is it habit? Is it social? Do you really like it?
Hmm.
But I would
Hmm.
really recommend you really, I don't want you to fully stop it because I think you will have really hard time. You've done this 10 years
Yeah.
plus since high school.
Yeah, yeah.
But, if you can really decrease it significantly and,
Hmm. Hmm.
and as you are decreasing that,
Hmm.
replace it with a better coping skill.
Hmm.
Exercise, running, other things that actually get you motivated, things that don't just dumb your brain where you just sit and relax. And then,
Hmm.
just go from there. I just think
Yeah,
you just
yeah.
you particularly in lifestyle modification. You don't need medication.
Yeah,
Okay,
yeah,
you
yeah.
have no
Yeah.
depression, you have very mild anxiety,
Hmm.
you just seem a little bit more confused to why all these things are happening. You just need to talk to someone, do some therapy. I'm here to help you anytime you're going to need any kind of medication. But I don't think the
Yeah, yeah.
running to medication is always the
Cool.
right answer.
That's great.
You should really find out what your reasons are.
Yeah.
Why are you doing all of these things? Okay, maybe you
Hmm.
started as a young person, it was like a thing to do then. But as you are older, you have different ambitions, different things you want to do in your
Hmm. Hmm.
life. Maybe I think it's
Yeah.
just best to just, write down your goals,
Hmm. I
and
think
ask
less sounds
yourself.
good. I think less, yeah, I think less is
I would
probably where I'm
definitely
at.
do less. I wouldn't want you to completely do it.
I
You've
don't think
done
I want
more
to
than
stop
so many
either.
years.
I don't think, yeah, I don't think
Yeah.
yeah, but I think,
And then let's see how you feel at one point. If you need to, like, if you feel like
hmm.
you need to be on medication, that's always an option. But for right now, decrease that. Start with therapy. If you're gonna need any kind of assistance from me in
Hmm.
regards to medication, we have some medications that I can always give, like on as needed basis for situational anxiety, because I think you're a pretty functional guy. That's always an option. Uh, a much better choice, less addiction, better controlled, to what's going in and what's coming out. Um, Healthier lifestyles, eating, exercising, and that's it. That's what you really need. I
Cool.
can keep your file on.
Cool.
If you
That's
ever
cool.
need anything, by all means, you're welcome to make an appointment again. We can go over things,
Sounds good.
and kind of go from
That's
there.
cool.
If you signed up with Brightside, I think that's a great idea. Were they able to
Cool.
give you an appointment right away?
Yeah, pretty close. I mean, I signed up last week, and yeah, I could have got one
Oh,
earlier. So,
that's good. That's good.
yeah, yeah.
I just hear that they have 2
Hmm.
weeks ago they had a waiting list, so I don't know what it is. That's why I
Oh,
asked.
okay, got you. Should be good.
Yeah.
Yeah. Cool.
Okay.
Yeah. Thanks for your.
Anything else?
Should be good. Yeah, I should be good. I'm looking forward to therapy, and we'll just go from there.
Yeah. Yeah. I think you'll do well. Just
Yeah.
hang
Yeah.
in there. If you need my help, like I said, I'm always here to help you if you need anything else, okay?
Awesome. Okay. All right. Thank you. Have a good one. Bye.
Have a
Bye,
wonderful
Miriam.
day. Pleasure meeting with you, Jared.
You too, Miriam. Peace.
Bye-bye.
Alrighty. So, whew, little scared about sharing that, but beautiful thing about these services is that I tend to benefit from them as well. So, um, yeah, I know I said I'd smoke less weed, and I'm motivated on doing that. So I suppose that is one of the benefits, a scary benefit of sharing this journey publicly while doing reviews. It's an interesting process. But anyways, that's my session, the psychiatry session. Ended up not being any recommendations for meds, but what I'll do is start another one for the therapy later. So we'll see. Okay. Until then.